on the 19th of October, passed by this August House. The Social Health Insurance Act replaced the outdated National Hospital Insurance Fund and established the Social Health Authority, which oversees 3 essential funds. This modern framework ensures that every Kenyan, especially the most vulnerable, can access quality healthcare services when they need it most. The shift from the National Health Insurance Fund model to Taifa Care is fundamental and radical in both scale and character. NHIF, if I give you a bit of example, NHIF served a few salaried Kenyans and those who could afford to pay. But Taifa Care covers every Kenyan, regardless of employment or financial status. Secondly, despite serving a limited class of citizens, NHIF nevertheless accumulated billions of shillings of debt because of misalignment between contributions and the actual cost of healthcare. Taifa Care has undertaken an accurate costing of all healthcare-related goods and services in order to provide timely, effective, and efficient service to every Kenyan that is affordable. Additionally, the NHIF had a waiting period lasting between registration and eligibility for service. I think it was like about 3 months. Under Taifa Care, citizens are eligible for all services upon registration. I therefore urge every Kenyan to take the most important step in securing dependable health care for themselves and their families. Register. Register now or at the earliest possible opportunity. Honorable members, for the first time in our nation's history, free primary health care is increasingly becoming available at dispensaries, health centers, and hospitals. Ambulance and emergency services are also slowly but surely being made available at no fee. Under Taifa Care, we have introduced a comprehensive benefits package that brings specialized care, such as cardiothoracic surgery, within reach for many Kenyans without the burden of financial strain. Through the Digital Health Act, we are revolutionizing healthcare delivery. Every step of the process, from registration, eligibility checks, to claims, is now digitized. By eliminating unnecessary human interaction, we are tackling corruption, reducing inefficiencies, and ensuring that resources are used where they are needed most. As a result, the good news, SHA will pay all October claims in full by next week. And it will continue like that going into the future. To date, over 15 million Kenyans have enrolled in Taifa Care, and more than 60% of employers have successfully transitioned into its framework. The newly established Social Health Insurance Fund empowers citizens to contribute towards accessing a broad range of healthcare benefits. This represents a seismic change from the old reactive healthcare model to a forward-looking system that prioritizes prevention and preparedness. Once the transition from NHIF is complete and Shif becomes fully operational, Kenya will have a healthcare system that guarantees dignity, peace of mind, and equitable access for every citizen for the very first time in our 60 years of independence. Honorable members, we have launched an ambitious healthcare program, one that Kenya has always needed and deserved. Like any major transition, there are challenges, but I promise you, we are fully committed to making the system work. As we roll out this program, we are listening to citizen voices and collaborating with counties to deliver better healthcare services. Through the Facility Improvement Fund, which you in this House passed, we will ensure that hospitals are equipped with the tools they need, medicine, equipment, and other resources necessary to provide quality care, while involving citizens in decision-making at every facility. We are now doing the heavy lifting, clearing decade-old debts, ensuring access to medicine and equipment, and stabilizing a system that had failed too many for too long. We are building a healthcare system that serves every citizen with equity and dignity. Over the past month, we have disbursed Kenya shillings 5 billion to settle historical debts owed to the public, private, and faith-based medical facilities, some of which have been pending for over a decade. Another 3.7 billion will be disbursed tomorrow. This underscores our commitment to ensuring uninterrupted delivery of healthcare services, and we will continue to clear the remaining balances in a phased-out approach over the coming months. This sustained effort aims to restore confidence in the healthcare system and ensure seamless access of quality services. Honorable members, there is a compelling body of data projecting that not only is the future of humanity urban, but also that Africa has the fastest rate of urbanization. Kenya is no exception, and in fact, many of our counties are urbanizing rapidly. Dear Kenyans, we have a date with an urban future, and the only choice we have is what this urban future will look like. Will it be characterized by decent, dignified, safe, and livable neighborhoods and communities? Or will it be haphazard, unsanitary, and safe slum dwellings? This is the fundamental question that our affordable housing plan seeks to answer. Kenya has a serious housing deficit, and the cost of housing is beyond the reach of the majority. While the social and economic efforts of this shortage are far-reaching, rent as a component of the cost of living is unsustainable. People are forced to choose between enduring long, punishing commutes to faraway homes or taking up less desirable spaces within reach. Supplying the number of units required to fill the affordable housing gap requires us to undertake construction throughout the country at the rate of 200,000 new housing units every year for 10 years.